Hey everyone, and welcome to today's Explainer. Have you ever actually thought of the human body as a sprawling, super complex, three-dimensional landscape? Well, anatomists and medical professionals totally do. It's kind of like trying to navigate a massive, uncharted continent. You can't just wander around the internal structures of the body and hope you end up in the right place, right? To actually communicate exactly where things are, we need a highly specific system of cartography. So today, we're going to explore the map of the human body, specifically zooming in on the invisible grid that lets us navigate all that internal geography.
So think about this for a second. How do medical professionals navigate the 3D space of the human body without getting completely lost? Imagine a surgeon trying to remove a tumor or a radiologist hunting down a super tiny bone fracture. Saying something is a little to the left or somewhere near the back is absolutely not going to cut it. They need a universal language, a set of standard reference points that are 100% foolproof, regardless of whether the patient is standing up, lying down, or in the middle of a really complex surgical procedure.
To keep us all from getting lost, here is the roadmap for today's explainer. 1. Mapping the human body. 2. Introducing body planes. 3. The frontal coronal plane. 4. Anterior versus posterior. And finally, 5. Real-world medical applications.
All right, let's jump straight into Section 1, Mapping the Human Body. We're going to start by establishing our North Star, which is the foundational language of anatomy.
Okay, so to drastically reduce confusion, the global medical community has standardized the way they view the body into this one very specific posture. It's called the anatomical position, and it acts as our universal starting point. Picture a person standing perfectly upright. Their feet are shoulder-width apart and parallel, toes pointing straight forward. Their arms are resting out slightly to each side, and, this is the really crucial part, the palms of their hands are facing completely forward. Now, regardless of how a patient is actually positioned in real life, like maybe they're lying face down or curled up in a hospital bed, medical professionals always use terms as if the patient were standing in this exact anatomical position.
And looking at a standard map brilliantly illustrates why this standardized position is so incredibly necessary. Think about a physical map for a second. North is always at the top, right? Well, in our bodies, the anatomical position guarantees that relative locations literally never change. For instance, because the palms face forward in the anatomical position, the palm side of your wrist is considered the anterior or front side. So if you have a scar right there on your wrist, it remains on the anterior wrist even if you were to rest your hand palm down on a table. The actual body might move around, but the map's orientation, it never does.
Okay, moving right along to Section 2, Introducing Body Planes. Let's see how that North Star we just talked about builds into our broader framework.
If the anatomical position is our North Star, then body planes are basically our latitude and longitude lines. But instead of just drawn lines, I want you to imagine these planes as huge, perfectly flat panes of glass slicing straight through the body. Since we are, obviously, three-dimensional objects, these imaginary two-dimensional glass panes help us create completely flat cross-sections, and that lets us look at internal structures from very specific, highly standardized angles. There are three main planes that make up this anatomical 3D grid. First off, we've got the sagittal plane, which is a vertical plane that divides the body straight down the middle into right and left sides. Then there's the transverse or axial plane, cutting horizontally across the middle, dividing us into superior, meaning upper, and inferior, meaning lower portions. But today we're actually going to focus heavily on that middle one, the frontal or coronal plane. This is the one that separates the front of the body from the back. Which brings us right to Section 3, the frontal coronal plane. Zoom in and take a real deep dive into this one specific slice of our anatomical map. So what exactly is the frontal plane? Okay, imagine one of those giant panes of glass slicing you perfectly down the middle, but this time it's sliding down from your side, literally going from shoulder to shoulder. It effectively separates your face from the back of your head, your chest from your back, and the fronts of your legs from your calves. It's a vertical plane running side to side, and it is absolutely vital for understanding the depth and the layout of our internal organs.
Now, here's a really fun fact about the etymology behind the alternative name for this plane. You are definitely going to hear medical professionals refer to it as the coronal plane. And yeah, that sounds like a super intimidating piece of medical jargon, but it actually just derives from the Latin word corona, which literally means crown. So if you picture a tiara or a crown resting straight across the top of someone's head, going from ear to ear, well, that is exactly the line the coronal plane follows as it descends through the body. Pretty cool, right?
Let's head into Section 4, Anterior versus Posterior. Because the frontal plane bisects the body lengthwise like that, it gives us two very distinct directional halves.
This frontal plane gives us two foundational directional terms that you'll hear all the time: anterior and posterior. Anterior, which is sometimes called ventral, simply means toward the front of the body. Posterior, or dorsal, means toward the back of the body. We lean heavily on these contrasting pairs to categorize literally all of our anatomy relative to that frontal plane. So, for example, your sternum, or breastbone, is anterior to your heart. Your kneecap, that's definitely an anterior structure. But on the flip side, your spine is posterior to your stomach, and your shoulder blades are posterior structures. It's really all about which side of that crown plane the structure actually lives on.
But here's the thing. This plane doesn't just divide the surface of our bodies. It actually categorizes our deep internal spaces, which are known as body cavities. The frontal plane effectively acts as this massive dividing line between the ventral body cavity in the front, which, houses our soft, super dynamic organs like the heart, lungs, and stomach, and the dorsal body cavity in the back. That dorsal cavity is entirely encased in bone because it houses and protects the highly sensitive command centers of our central nervous system, the brain and the spinal cord.
All right, bringing it all together in Section 5, Real-World Medical Applications. Now, you might be sitting there wondering why on earth you need to memorize imaginary panes of glass and Latin crown references. So let's look at the real-world applications of all this cartography.
The absolutely crucial takeaway here is that without these defined planes, modern medicine as we know it would basically be visually impaired. Think about it. When a patient goes into an MRI or a CT scanner, the machine doesn't just snap one big 3D picture. It actually uses these exact anatomical planes, the sagittal, the transverse, and specifically that frontal or coronal plane we just spent time on, to create two-dimensional virtual sections or slices of a living body. By scrolling through these coronal slices, a doctor can visualize the exact depth and location of a tumor or spot a super complex bone fracture, and they can do it entirely without making a single incision with a scalpel. It is literally the ultimate surgical planning and navigation tool.
We've covered a whole lot of ground today, right? Mapping the human body all the way from the standardized anatomical position down to the critical dividing line of the coronal plane. It turns out you are an incredibly complex, beautifully organized piece of geography. So I want to leave you with a bit of a challenge. The next time you see an X-ray, an anatomical diagram, or maybe even just an MRI scan on a medical TV show, ask yourself, are you looking at an anterior view or a posterior view? Which imaginary pane of glass is slicing through the image? Apply your new cartography skills and keep exploring the amazing landscape within. Thanks so much for joining me on this explainer, and I'll catch you next time.